Hey guys, this is not the usual intro to my videos, and that's because this vlog is actually part 2 of a week in my life. I just had so much filmed that if I put everything in one video, it would have been like an hour and a half, and so I split it up into 2 videos. So if you want to watch part 1, I have it up above in the cards somewhere and down below in the description. If you're coming from part 1 or just want to watch this video, that's totally fine. You can keep watching. This video picks up on a Wednesday, so enjoy. Hey guys, what is up? Today is Wednesday, October, I don't know. I think today's the 25th, I think. Anyways, I am very late. On my way to class, like very late. It is like 9:40 and I'm normally like on campus by now, and I just left Starbucks. So I am gonna be a little teensy weensy, little bit late, I think. Probably like on time, but my version of like on time is walking in like 10 minutes before class starts, and I'll probably get there like right before class starts. So I won't be like actually late, but like a little bit. I tried my hardest to read the fluids and electrolytes chapter, but I literally kept falling asleep. Like I couldn't even stop myself. Like I didn't even realize that I was falling asleep until I would like wake up and I was like, oh, I was asleep. That happened several times. So I feel like I'll be okay for today's lecture. I'm not exactly sure. We're probably supposed to like go over like the index cards that I was showing you like yesterday. So that, but I don't know. We'll see how it goes. Hey guys, it is I. It is about 2 o'clock in the afternoon. I spent some time in the library with Cole and Hannah, so we did that. This morning was hectic. I was not late to class. I ended up being like on time, which was good. The lecture was a little difficult to get through because I was like kind of tired and my brain wasn't really working. So we started fluids and electrolytes, and it was like okay. Like we finished like sleep, I think, pretty sure. We finished sleep and we did Kahoot. I was number 3 on the podium. We did fluids and electrolytes. We basically watched like a Mometrics video. It was a little dense, and like I'm not the type of person that can like watch a video straight through and retain it. I have to like pause several times to like stop and think about it and take notes. So like I was kind of checked out while watching the video because I'm like, I'm not gonna be able to retain any of this. So I have a lot of studying to do. But like it's tricky because my brain isn't really working right, and I can, you know, you can like feel it when you can't think. Like you try to read something, it won't stick. Like that's what I'm going through right now. So it's really tough because I need the information to stick and it's like not sticking. I don't know, we'll see. We'll see where the day takes us. Hey guys, it's 11 o'clock on Wednesday night and I am actually doing work. OMG, this is so nice. I was doing homework. I'm doing some lab stuff right now. For lab tomorrow, I have to do some readings, my lab manual, so that's what I'm doing like right this second. I'm doing drawing a medication from an ampule, drawing a medication from a vial, intradermal injection, subcutaneous injection, and intramuscular injection. And I'm gonna focus more on sub-Q and IM because that's what I'm getting evaluated on for skills check-off next week. And then I have to watch videos for sub-Q and IM. I have to do a case study for sub-Q, and then an ATI module for intradermal and intramuscular and subcutaneous. Basically parenteral injections. I have to do an ATI module for that, and then I did 2 skills templates. I did sub-Q and IM, and then I just have to do a med template for morphine sulfate. So I'm going to actually show you what my templates look like. So this was my template for, I don't know, this one was intramuscular. Oh, this one's sub-Q injection. That's pretty much what they look like. I don't really write like a whole lot. Like in the beginning of like the semester, I would literally fill up every little white space of information. Like I can show you one from a clinical template that I had to do. Wild. Absolutely wild. I don't even, I feel like you're gonna judge me a little bit. So this was oxycodone, and I went absolutely ham on can you even read this? Like, wait. Let me just do this. Why am I doing this the hard way? Like, can you even read this? Like, this is like insane. Like, like, hello? Like, crazy. So, I have grown out of the need, I have grown out of the need to kind of like fill every little space up in my templates. And I kind of just write, most of the time now I'm just writing from memory, at least for the skills templates. So it's like a lot easier because I would have learned about the skills before. Like we had to know injections for our exam from, was it last week? Or was it the week before? When was my exam? It was the 18th. So basically last week, yeah. So we had an exam last week and I had to know that. So I already knew how to fill out the template, but morphine sulfate I've never looked at before. So I'm gonna go through my Davis's drug guide. I'm actually just gonna do it now. It's just easier now that I have it in my hand. Under M. And if your school uses ATI, you're probably going to end up having to do these templates. And if you do, for medication specifically, I highly recommend this book because it just has everything there. You don't really need to like go looking for the information. So this is, if you've never seen this book, this is what it looks like on the inside. It has the drug name, the therapeutic and pharmacologic class, the indications, which basically means like what you would use it for, the action, like what it actually does like in the body to achieve its therapeutic effect. It goes through pharmacokinetics, which is basically like how the drug like moves through the body, like how it's absorbed, how it's distributed, how it's excreted, whatever, the half-life, the peak, contraindications, which basically is like you probably don't want to use this drug if your patient has certain conditions, and then precautions, and then adverse reactions and side effects, interactions, and then the different dosages and routes in it, and then nursing interventions, patient education. Like, it's wonderful, this book. Oh yeah, and also what to assess for. I forgot. Jeez, it even has the prices. That's crazy. So yeah, so for example, like for nursing implications for morphine, it says assess type, location, and intensity of pain prior to and 1 hour following PO, which is by mouth, subcutaneous, IM, which is intramuscular, and 20 minutes peak following IV administration. When titrating opioid doses, increase of 25 to 50% should be administered until there's either a 50% reduction in the patient's pain rating on a numerical or visual analog scale, or the patient reports satisfactory pain relief. Like things like that. High alert. You want to assess level of consciousness, blood pressure, pulse, respirations before and periodically during administration, because opioids can cause respiratory depression, which can be not good. Okay, so it's a little after midnight. It's like 12:30. I finished my medication template. It took forever, but it's okay. I'm starting my readings for sub-Q and IM injections. I'm going to watch the videos on it, and then I'm going to go to bed, and then I'll do the ATI in the morning because I'm just like, I don't know. I don't know what to do. Like, I feel like I could keep going, but like it's gonna be 1 o'clock. I'm gonna get up early, and like I don't know. I don't even know if I'm gonna be able to fall asleep, but I'm gonna try to gauge. I don't know, it's kind of hard. So I'll see you some point later. Hey guys! So it is Thursday, October 26th, and I did not film much this morning. It was a bit of a crazy morning. I did read all my lab skills. I watched the videos on them. I did like most of the ATI module. I was supposed to do a case study, didn't do that. I was supposed to read ATI chapters, didn't do that. I was supposed to go into DocuCare and, you know, pre-read or prepare, I guess, for today's lab. Didn't do that, and that was fine. That was fine. We did sub-Q and IM injections. That was the focus of today's lab. We learned a little bit about beta blockers, like what makes them selective, what makes them non-selective. My instructor taught us the BEAM acronym. Like, you have one heart, so it's like one, beta 1 affects the heart, it's selective, and you have one heart, which makes you happy, and so you're gonna beam, you're gonna be like beaming, so it's BEAM. B for bexatilol, E for esmolol, A for atenolol, and then M for metoprolol, and all of those are the selective beta blockers. And then if it's not one of those, it's non-selective, which affects 1 and 2, and beta 2 blockers affect the lungs, and then ACE inhibitors affects the kidneys. So that's what we learned, aside from injections. I actually want to show you something really cool. Ooh, I have orange juice in the back, see the little spill. Okay, so we got these lab kits in the beginning of the school year, and I went through a demo of like what's in there. So if you want to see like, you know, exactly everything that's in here, I did a little video on that. So in it, they gave us gloves to practice with, so I just put them in here. I have a syringe with a needle. I have alcohol prep pads, and where is the thingy? Oh, this thing. An injection simulator. So we were using this today, and so I was practicing, and I'll show you at home like how I do it, but it's pretty cool. Okay. Hey guys, I'm home from lab. I am going to show you what I practiced in lab today. I'm very excited. I did order needles because my school didn't give us any, so I ordered them from Amazon. First step is to do medication reconciliation. We check for their allergies. So I'm going to show you in the patient's chart. I don't know if you can see it. Hopefully you can. It says known allergies. So we're good to go there. I go to the physician's orders, and then I check the medication that I'm going to administer. So in this case, it's morphine. Morphine sulfate, I see that it's 5 milligrams subcutaneous, PRN, Q6 hours. And then their notes, administer PRN per patient report of moderate to severe surgical pain. And that's going to be a subjective numerical scale of more than 7 out of 10. Hold the medication for respiration rate less than 10 breaths per minute and notify healthcare provider. Hold medication for systolic blood pressure less than 100 millimeters mercury and notify healthcare provider. Activate rapid response team per protocol parameters. So that's that. So I checked the order. I'm going to check that against the medical administration record to make sure that they match. So then I see morphine sulfate, 5 mg, subcutaneous, PRN, Q6H. That matches the order, and the order is complete. So I'm checking to make sure that it's for the patient. I have the date and time. I have the name of the medication, the route, the dose, the frequency, There should be 7 things. Date and time, person, patient, med name, route, dose, frequency, signature. Yeah, so the order's complete because it has those 7 things. Okay, so once I did my medication reconciliation, I go into my drug guide or the computer or whatever. I find the medication. So we're doing morphine. Morphine. Okay, so I have to figure out this. This is for my evaluation for next week. But it says I need to do expected action, safe dose, side effects of drugs. And then my professor also wants me to name the therapeutic class and action in addition to that. So, oh, action, they already said. So, I see morphine. The suspected action is that it's going to bind to the opiate receptors in the central nervous system to alter the perception and response to painful stimuli while producing general central nervous system depression. The therapeutic effects is to decrease in severity of pain, and I make sure that this is appropriate for the patient, which it is because she's post-op and she has pain, and the right amount of pain. She has more than 7 out of 10. I need to look at the safe dose. So then this is where I have to go to the dose part, and it says for IV, IM, subcutaneous, adults more than 50 kilograms, the safe dose is 4 to 10 milligrams every 3 to 4 hours. So when I take the max dose, 10, I take the fewest, shortest frequency, which is 3 hours. So I multiply, I have to figure out the daily dose. So 10, multiply that by 8. So I get 80 milligrams is the max daily dose. And then I look at the MAR. The MAR is 5 milligrams every 6 hours. So that's going to be 5 milligrams given 4 times a day. This is the PRN. But hers would be 20 milligrams within 24 hours. So that's a safe dose. That's within the range. So it's not toxic. Then we have to look at adverse reactions. We're going to look for respiratory depression. So respirations less than 10 breaths per minute. Other one, that's just the one bolded in red. So I feel like that's the only one I have to say for my test. But if you're curious, hypotension, bradycardia, flushing, itching, sweating, blurred vision, diplopia, meiosis, adrenal insufficiency, constipation, nausea, vomiting, urinary retention, confusion, sedation, dizziness, dysphoria, euphoria, floating feeling, hallucinations, headache, unusual dreams, physical dependency, psychological dependence, tolerance. So that is the adverse effects, and then I would need to name side effects, which I think I did. I think that's what that covers. Cute. And then my teacher also wants us to say the therapeutic class, which is an opioid analgesic. I think I got everything. So now I would do hand hygiene. So I would hand hygiene, and then I can put this away for like a split second. Actually, no, I can't. So now I'm going to prepare my medication. So I'm looking at the medical administration record, which I already verified matches the order, so I don't have to look at the order anymore. I have my little vial. Let's pretend this says morphine. So this says morphine. I'm checking the label to match the medical administration record. I see that it's 5 milligrams. It says 10 milligrams per 1 ml, so that means I'm going to draw up in my syringe half of a milliliter, to give us 5 milligrams. And I'm checking the expiration date. This expires February 2024, so we are good. Okay, so we did that, and now it's time, I think, right? I checked. I'm doing this. So now she said wear gloves when on. Okay, no, I don't need to wear gloves when I draw up the medication, but I need to wear gloves when I administer it, according to my professor. I'm just gonna go with that. So I open this, okay, and then I avoid touching like the inside part of the barrel, so I'm gonna touch the outside part. I'm gonna screw this on. Very nice. Okay, this is good. Oh wait, can I use this? Because this is like sterile technically. Okay. I take off the cap. Very nice. This can go somewhere. This comes back. Okay, so first, is there stuff in here? No, okay. So first I'm going to, I know that I'm going to take out half of an ml. This is the wrong kind of syringe, but it's okay. I'm going to take up half, actually no it's not. I'm going to take up half of an ml, half of air. I'm going to, take this cap off. I'm going to inject, oh, this needs to be on a flat surface. Inject into here. Oh shoot, no, I did wrong, no! I was supposed to rub the thing with the alcohol wipe. So pretend I did that. I'm injecting the air, not into the solution itself, but into like the air gap in the vial. So I'm drawing up half of a milliliter into the syringe, making sure there are no air bubbles. Oh, okay, cool, we're at half. Okay, so, did that. I'm going to, I can't recap, oh yes I can. So they tell us to recap this. This is ready to go to the patient now. Okay, so then, okay, cool. So now I identify, no, I go in the room, I introduce myself, perform hand hygiene again. Did I say introduce myself? I verify that the client has no allergies, and then I explain the procedure, provide privacy, gather my supplies, which includes my medication cart for my computer, my med, okay, and then I verify name, date of birth against the medical administration record. I make sure that the name and date of birth matches the ID, which I scan into the system, good. I scan the med, good. I put gloves on. Well, I perform hand hygiene again before I put on gloves. Put my gloves on. Okay, and then I get my patient. Okay, I get an alcohol wipe. Oh wait, so I find anatomical landmarks. So pretend I'm doing deltoid, I'm doing an IM deltoid injection. So I find the acromion process, it's like the bone part of the shoulder. I go 3 finger spaces down, right about here. I palpate to make sure that I'm touching the muscle, which, yeah, it's like about, I can feel it on myself, it's like right here. This is my spot. So then I get my alcohol wipe, which I already used, but whatever. I go in a circular motion from the injection site outward. Cute. Done. I let it dry. I don't wave it. I don't blow on it. I just let it rock. I feel like that's it. I feel like that's it. Hopefully. So then I uncap this. For an IM injection, you could use Z-Track, but since it's just a small spot on the arm, I'm gonna spread with 2 fingers, or should I spread like that? No, spread like this makes more sense. Okay, so I'm gonna spread the area to displace the skin. I'm going to use a dart motion, putting in very quick, 90 degrees. I depress the plunger all the way down. Okay, I let it sit for 10 seconds, question mark. Oh, I injected too fast. Actually, no, I didn't. It's supposed to be 10 seconds per milliliter. I did half a milliliter, so it's supposed to be 5 seconds. Oops. I kind of injected a little bit too fast. So I wait 10 seconds. I quickly take the needle out at the same angle that I put it in. So boop. Oh, this is supposed to go in the sharp spin. Oops. I'm just holding my hand, just like sharp spin. Cool. Got that. Band-aid. Cool. Right? That's it? I feel like that's it. Gloves come off. I'm going to take them off the wrong way because I'm going to reuse these gloves. Okay. So that would be that, right? I think. Okay, so that is what I learned. I probably did a lot of things wrong. Like I caught myself at some of it. Please be gentle on me in the comments because I literally just learned it like today. And I will practice a lot before my evaluation. Hey y'all, what is up? It is Thursday. Oh, I have my Apple Watch on the other hand. It is 6 o'clock on the dot, and I am going to Panera to study with my clinical friends, and we're studying Dosage Calc. So that's, why did my eyes look like that? Sorry, my eyes are like popping out for some reason. Studying Dosage Calc at Panera. It should be fun. I think everyone's coming, because normally we're always missing like 1 or 2 people because they live far, but I think we're all gonna be together, which is really nice. I was actually able to be productive. I did the things I was gonna do. I actually did the things. I did my VSAM guided reflection questions, and I did my, what else did I do? I did something. Oh, I did Dosage Calc textbook chapters 3, 4, 5. So I'm just gonna do 6, is it 6, 9, 10 that I just need to do? And then I'll just do those in between now and Wednesday, so I'm good for the test. I feel like I'll be in a good spot. So, yay! Okay, so I'm at Panera. Everyone left the room, so I don't have to be weird about it. So, Kiara got me free soup and a free drink. That's amazing, I love her. One of my classmates got me free medical supplies for injections, so that's super exciting. So thank you, Sam and Kiara. Freaks me out.
Oh, Kiara, she's a YouTube famous girl.
Oh, really? I'm not famous.
With a little flip kick.
Spread.
Yeah, she does.
Hey guys, what is up? Today is Friday, October 27th. 1989 Taylor's version came out today, so I didn't listen to it yet, but I'm going to in like a hot second. I just came home from work. It is like, actually that's not true, 10:36. I got off of work at 9:45, but I was on the phone with Brooke for like an hour because she is in Georgia this week with her family. So I'm just here by myself, but it's okay. I did Dosage, I don't think I've filmed very much after I got home, or okay, so I did Dosage Calc with Sam, Cole, Andrew, and Kiara last night. Had so much fun. Came home, passed out, woke up at 4:30 this morning 4 a.m. this morning for work, worked. I'm home now. Plan for the day is to get ready for Monday's lecture, which is finishing up fluids and electrolytes. I'm gonna finish fluids and electrolytes, that chapter. I'm gonna work on my index cards, try to figure out that situation. I want to finish my care plan for clinical. I need to submit my guided reflection questions for the VSAM. Like, I finished it, but I didn't like submit it because my process is to kind of like work on, like if I have like a written assignment that I need to turn in, I'll like work on it, finish it, wait like a day or two, and reread it again. This way I'm like detached from it, and so I can catch mistakes better. So I'm gonna do that. I want to work on something for ASU. I'm technically like a week ahead where I was, but I want to keep it that way. If I finish a quiz, I have a quiz due November 4th. November 1st is a Wednesday. November 1st, Thursday, Friday, Saturday, Sunday. November 5th, I have a quiz due. I'm gonna do that today. This way I can just be good. I'm gonna do more Dosage Calc prob questions, and I feel like that's it. I would like to get some housework done because Brooke is coming over Sunday night and my apartment is a freaking mess. It's in shambles right now. So I would like to start cleaning, get ahead on that. I feel like today was a day I wanted to go to Home Goods. Oh, I got paid today. That's why I was waiting to go to Home Goods. I got paid. Where's my phone? Yes, I want to see how much money I have to see if I can go shopping. Yikes. Ooh, I'm rich. Sorry. My mom's bank account is negative, so I'm gonna cover her. I got $63. All right. I got paid. Ooh. I've just had to plan out my day. I won't waste your time talking about my plans because they're probably going to change anyway, but I will see you when I do whatever I'm doing. I don't know if that makes any sense. Okay, so it is 2:30 and I'm doing dosage cal questions, and I'm like, oh, maybe they want to do one with me. So let's see. Doctor orders 500 ml of a drug, 0.5 grams to infused 50 ml per hour. How many milligrams will the client receive each hour? The blank stares. Okay, so let's see if I can figure this out. These questions are getting like so hard. I was so confident about dosage calc, and now these questions are like really messing with me. So ml 500. Okay, so let's put 500 ml over equals 50 ml. Oh, and it's 0.5 grams. Okay, cool. So 25 divided by 500. And it's 0.05 grams, which is 50 milligrams per hour. Hopefully. I feel like I need to get this one right. Say psych right now. Wait, did I get that wrong? Are you serious? Oh, it was number 9. Okay. I didn't realize I skipped 8 and I did 9 and I was like, wait. Yay, it's 50. Yay, we got it right. Okay. OMG. Hey guys, it is about 3 o'clock. I finished my dosage calc work for today, and so I'm continuing to work on my care plan, my very first care plan to my very first patient. It's so fun. So basically what my school had us do is they had us go to clinical. You know, we go on a weekly basis to the hospital, and my instructor gave us like a census list, and she told us to pick a patient based off of their diagnosis of what we'd be interested in making a care plan for. And so I chose my patient, and I got very lucky because from the previous week at clinical, I was very stressed out because like I felt really awkward about talking to my patient, and like I was really in my head about like, will I be able to be a competent nurse? Will I be able to communicate effectively with my patients? Because that's like such a huge thing, and I just felt so, I like froze basically like the last time I went to ask a patient for anything. I was just so in my head, so anxious. But I went in last week with a different patient, and like everything was just so smooth. Like because I told you on Monday like how like I practiced like taking a health history, and from there it just felt like a conversation. Everything like flowed really well, and it was great. And so basically, based off of my assessment data, I had to do like an assessment on the patient. Based off of my assessment data, I am making a care plan. So I had to make my nursing diagnoses, at least 3 of them. And then for each diagnosis, I had to do 5 interventions. Or for each diagnosis, I have to do 5 interventions. And then I have to do I have to make the outcome goal, or the outcome, right? Outcome goal, outcome statement, whatever. The intervention, the frequency, the rationale, and then the evaluation. And then that's what's being graded. So I want to show you. I worked really hard on it. Okay, so this is what it looks like right now. So I want to preface that if you see any patient information, it's not real. This is just based off of how I would have cared for my patient, if that makes sense. Hopefully I'm not breaking HIPAA. I don't think I am, but hopefully not. So I have deficient fluid volume as one of my diagnoses. So I have my goals that the patient will maintain adequate fluid volume, they will maintain weight appropriate for height, they will tolerate PO liquids, and then I will monitor for signs of hypovolemia, I will note skin turgor, I will monitor fluid intake and output, hydrate client using IV fluids, administer Zofran as prescribed. And then my other one was risk for electrolyte imbalance because of the fluid deficiency. So then we have maintain normal serum. I'll put the values in here. 3.525 per liter. Look at me knowing my little values. And then hold on. 1.3 to 2.3 MEQ per liter. Wow, look at me. Maintain normal regular heart rate and rhythm. Tolerate fluids administered. And then, so this one's a little bit long. So I will monitor for hypokalemia, hypomagnesemia, monitor cardiac rate and rhythm, administer fluids, educate patient on signs of low potassium, low sodium, teach client about the medications that are prescribed, instruct the client to report any adverse medication side effects. I feel like I can add more to this one, but that's just what I have so far. I only have to do 5, so I feel like I could like add one, but then I'm only supposed to add like what is in my diagnosis book. Oh, do a neuro assessment. I feel like that's in there. Do a neuro assessment on them. I could do, for the other one, I could teach about like signs of dehydration. I think I could do that one. So I have the patient will verbalize strategies to enhance self-care. I think I'll do 5. Promote trust and enhance communication between patient and healthcare team. Help patient identify and reduce barriers to self-care. Provide literacy appropriate education for self-care activities. Promote the patient's hope to maintain self-care and discuss with the patient 5 coping strategies to relieve stress. I feel like that's good. That is a super, super, super basic care plan, but it's my very first one. So I'm excited. We're gonna go more in depth with care plans next semester in med-surg, but they just wanted us to get like somewhat familiar with them. So when we are doing them like routinely, it's not such a shock. So hopefully I'm doing okay. I don't really know. My clinical instructor will grade it and then give me feedback. So we'll see how that goes. Hey guys, it is October 28th. I just wanted to say hi really quick before I went to work because it is 2:57 and I go to work in 3 minutes, so I have to clock in. I've been listening to 1989 Taylor's version nonstop since 6 p.m. yesterday. Like literally, I listened to it for 6 hours. By the way, what is your favorite vault track and why is it Slut? That's all I gotta say. I'll talk to you guys later. Hey guys, it is 8 o'clock. I got off of work. I'm going to crumble. So I will film a little bit, but maybe not. I'm not sure. But I'll see you later. Hey guys, it is Monday morning. It is October 30th. And I did not film at all yesterday because I kind of felt it was kind of boring. I basically cleaned my apartment. I did some laundry. I watched copious amounts of The Real Housewives of New York City. And I ate a lot. And I don't really think I got any schoolwork done, which was kind of bad. I'm currently on the way to my 8 a.m. class and there's lots of traffic and I'm going to be late, which is really fun. But I wanted to film an outro just because that needs to be done. I feel like I did something yesterday and I don't remember what it was because it wasn't read my textbook and that was like the one thing I was supposed to do. Oh wait, no, I don't think I did anything yesterday. I did nap though, but that's it. So that has been a week of my life. If you made it this far in the video, thank you so much for watching. If you want to see my face again, consider subscribing and I'll see you next time. Bye.